Welcome to This Explainer. Today, we're completely unpacking the groundbreaking science behind mTOR inhibitors and how they might fundamentally change how we age. We usually think of getting older as this inevitable, unstoppable rust that just sort of accumulates over time. But what if it's not? What if aging is actually driven by a specific biological engine, an engine we can literally learn to tune?
The story of how we actually found the key to this engine sounds straight out of a sci-fi movie. It starts with a macrolide discovered in, of all places, the dirt of Easter Island almost 50 years ago. This compound is called rapamycin, named after the island's native name, Rapa Nui. Now, it was initially just identified as an antifungal and later used as an immunosuppressant. But today, rapamycin is at the absolute center of a massive biological anti-aging revolution. Which brings us to part one of our explainer, the engine of aging. To really understand how rapamycin works and why scientists are just so incredibly excited about it, we need to look under the hood. Meet mTOR. That literally stands for the mechanistic target of rapamycin. It's an evolutionarily conserved protein kinase, but honestly, you can just think of it as a master switch, or like the accelerator pedal in a car. When nutrients and amino acids are abundant, mTOR senses them and tells the cell, hey, let's grow, let's build proteins, let's divide. And that is absolutely fantastic for development when we're young. But here's the catch. Running that engine too hot when we're older actually drives cellular exhaustion and age-related decline. It's a classic case of antagonistic pleiotropy. Basically, what helps us grow early in life ends up seriously harming us in post-reproductive old age.
Moving into part two, the rapamycin brakes burner.
So once scientists mapped out this pathway, they naturally started wondering, well, what happens if we put the brakes on it? And what shocked researchers was how consistently turning down this pathway worked across entirely different species. Over the last couple of decades, they found that genetically or chemically turning down this pathway extended life in yeast. Then they saw the exact same thing in worms, then in fruit flies, and finally, in a landmark 2009 study by the National Institute on Aging, it demonstrated incredible lifespan extension in mammals, specifically genetically heterogeneous mice.
Rapamycin proved to be just an extraordinarily robust geroprotector in these animal models. And here's the crucial distinction. It wasn't just keeping them alive longer in some frail, miserable state. It was genuinely extending their health span. The research shows it reduces cancer incidence, which, by the way, is the most common cause of death in lab mice. It inhibits the accumulation of those aging senescent cells that drive physical decline. And crucially, it rejuvenates hematopoietic stem cells. Basically, this restores the function of an aging immune system to a much more youthful state. And that perfectly sets the stage for the human clinical trials we're going to talk about in just a minute.
But honestly, here is the absolute most hopeful part of all this research. We've known for a while that extreme calorie restriction can extend lifespan, but if you start a severe calorie restriction diet late in life, it actually loses a ton of its efficacy. But rapamycin, researchers found that even when they started dosing mice at 20 months of age, which, to put that into perspective, is roughly equivalent to a 60-year-old human being, they still saw a robust extension of lifespan. It's literally never too late to start tuning the engine.
Let's look at part 3, the mTOC1 versus mTOC2 dilemma. Of course, any biological hack comes with complications, right? And the early clinical ambitions for bringing this healthy aging drug to humans definitely hit a roadblock. It really comes down to a tale of two protein complexes. The mTOR kinase actually forms the core of two distinct complexes, mTORC1 and mTORC2. Now, rapamycin's incredible health span benefits, like slowing aging and triggering a really cool cellular recycling process called autophagy, those all come from inhibiting mTORC1. But prolonged high doses of rapamycin eventually starve the cell's ability to assemble mTORC2. Inhibiting mTORC2 is basically the collateral damage here. It causes nasty side effects like insulin resistance, hyperlipidemia, and immune disruption. So this creates a massive clinical dilemma. Rapamycin and its analogs, which are known as rapalogs, are actually already FDA approved. But they're traditionally given chronically at very high doses to completely shut down immune rejection in organ transplant patients or to stop cancer cell growth. Because of this chronic high dosing, the drug hits both mTORC1 and mTORC2. That's what causes those severe side effects like canker sores, high blood sugar, and high cholesterol. This is exactly why that specific high-dose regimen is just way too risky for healthy older adults. I mean, you simply cannot risk dangerous metabolic and immunosuppressive side effects just to slow down the aging process. Which brings us to part 4, human clinical trials.
So how exactly do we thread this needle? How do we get the incredible longevity benefits of mTORC1 inhibition without the dangerous side effects of mTORC2 inhibition? While supported by rigorous institutional research, scientists realized they needed a completely different dosing strategy. They theorized that low, intermittent doses could selectively target mTORC1 while leaving mTORC2 perfectly intact. Think about it. The goal isn't to shut the mTOR engine off completely, because that's what triggers those transplant-level side effects, but rather just to turn it down to a youthful baseline. And recently, they've been testing this exact theory in older human adults.
Now, what is truly mind-blowing about these trials is the time frame. In some of the largest clinical studies to date investigating mTOR inhibitors for aging, guess how long it took? 6 weeks. Just 6 weeks of low-dose or intermittent mTOR inhibitor treatment was enough to show remarkable rejuvenating effects in elderly humans. No way, right? And the results were absolutely stunning. Instead of suppressing the immune system like the high doses do, these brief, low doses actually rejuvenated it. Older adults who got the low-dose treatment saw a significant decrease in the percentage of exhausted PD-1 plus T cells in their blood. They also showed a massively improved response to the flu vaccine. And, incredibly, they experienced significantly reduced rates of severe viral respiratory tract infections. By just mimicking the healthy mTOR balance of a younger body, they essentially upregulated the body's natural antiviral immunity. It's a real game changer. Let's jump to our final section, Part 5, the future of healthspan. You see, optimizing the dose of existing drugs is really just the beginning of this story. The future of healthspan is all about precision. First off, researchers are developing next-generation drugs, like one called DL001, that are designed to bind with extreme selectivity to mTRC1, completely bypassing all that mTRC2 collateral damage. Second, because MTR senses amino acids, scientists are actually finding that targeted dietary tweaks, like restricting your intake of specific branched-chain amino acids, such as leucine, can naturally turn down mTRC1. And third, we're seeing the localized use of these compounds. For example, clinical trials have shown that applying topical rapamycin creams to aging skin significantly reduces senescent cells and improves collagen production. I mean, imagine treating aging skin at the cellular level without the drug ever even entering your bloodstream or risking systemic side effects.
The sheer momentum of the science right now is just incredible. We have a clear blueprint for the upcoming decade. There are dozens of active clinical trials happening as we speak, looking at mTOR inhibitors for conditions ranging from Alzheimer's disease to sarcopenia. There's even a massive open science study happening right now in companion dogs. And that makes sense, since large breed dogs share our environment and develop very similar age-related diseases. All of this rigorous data is actively paving the regulatory pathway to safely bring mTOR inhibitors right to the geriatric bedside. So, as we wrap up this explainer today, I want to leave you with one final provocative thought. For the entirety of human history, aging has been viewed as a one-way street, right? Just an inevitable decline. But if we can now safely reach into ourselves and chemically tune the master biological switch that dictates how we age, is aging no longer an inevitability, but a treatable condition? Thanks so much for joining me, and keep questioning everything you think you know about getting older.